Hello, this is Dr. Jimenez. We're presenting today on a very important matter. We're going to be talking about antiviral strategies. We have a crew that put together that what we're going to do is we're going to be discussing things we can do in terms of what we have as options for ourselves. I have here Trudy, who's going to bring out some questions regarding exactly what people are worried about, because there's quite a bit of misinformation out there, misinformation that leads people to do things like buy toilet paper or do things that are kind of offset and extremes. It's an attempt to discover options and to do the best we can. So though a lot of the public media has focused on what's wrong, but they don't really give us options that the average family can do in terms of what they can do in their home to prepare for this in a physiological way. So the habits that we have in today is that we tend to forget about great science that has been done in the past. The sciences that have been done in the past have given us insight as to how to deal with RNA viruses and the replication process and how to mitigate the process if we do tend to have that kind of dynamics in this arena. So in terms of our ability to come up with a plan, what we do is what we're going to do as a physical medicine practice is tell you what we tell our patients, what I tell my patients, and leave it at that, because we're going to have Dr. Ruja later tonight, and we're going to have Alexander right now, who's actually going to be discussing a little bit of the biophysiology. We have a state here who's going to be going over some documentation along with some studies that we have, and we're going to have some take-homes with Kenna. Kenna is our health coach that we give and advise people as to what options that the state should do. But bear in mind, all the information here is for reference only. It is always wise to listen to your doctor to come up with the antiviral strategies if that's necessary. But these are more of information as to what we can do in a family and things that we can find, and the focus is on preparing our human physiology in the event that some sort of dynamics enters into the arena of your families. Okay, so what we want to do is preparation is key. So what we're doing here is we're going to be discussing antiviral strategies. HDMI, please. The antiviral strategies are going to be discussed in a 4-series and tiered structured format. Here we have a Venn diagram discussing the antiviral approaches, which is going to be natural ways to prevent antiviral approach, at least entry into the body. We're going to talk about the anti-replication process. We're going to be talking about immunonutrition and cell support. Now, on the bottom, you're going to notice that the works from Dr. Alex Vasquez, who's one of the prominent guys that's leading the information of data acquisition, is at the bottom there. Now, you can actually access his information. And by the way, if you go back to the first page on the outside, you can actually see that up on top, on the bottom there, you have free access to this presentation so that you can later use it as needed. You also have the ability to look up his books and find out a lot of the background data that he put together over the last decade or two regarding antiviral strategies. Now, since he's one of the prominent guys, what we're doing is we're presenting the information so that we can give it to you, and you will be able to come up with some ideas and ways to prepare your family in the event that, this kind of stuff creeps into your town. Okay, so this is what's important, and it has lots of hundreds of documents and years of PhDs doing the work behind here. So what I'm presenting is kind of the pinnacle of the information, but it should not be, and it should not replace your good logical doctor and the information that your physician does provide for you. This is not medical advice. This is only information so that you can basically discuss with your family and prepare your family in a much more logical approach, because preparation, again, is key. Let's go back into the antiviral strategies. At this point, we're going to be looking at the Venn diagram, and as you can see, much of this overlaps. This information overlaps, and it means that in the terms of the supplementation, a lot of the supplementations that works for antiviral approaches also works for anti-replication genomics. Now, when it gets to a little bit of the genomics and the information that's a little technical, we're going to have Alexander. He's from Chicago. He's working from the National Institute. What is it? Where are you at, Alex? At the National University of Health Sciences.
University. Yep.
So he's actually
National
over there.
University of Health Sciences.
So he's out there, and he's listening in, and he's going to give us some information as we go through this technology. Let's go to the first approach, which is the antiviral approach. Now, in terms of this, what we look at part one, as we go on the Venn diagram, you see what we're actually focusing on. We're going to focus on interventions that act on the virus level itself, targeting the metabolic and replicative machinery that is part of the virus entry. Now, let's back up a little bit. There are things that we can do to prepare our body. One of the things is to support our bodies. And if you can go to the nutraceuticals area there, and you can actually see on the bottom is nothing replaces good rest and good sleep. This is important. When we look at this virus, it typically enters in through some sort of mucosa, whether it's through the eyes, whether it's through a crack in the skin, or even through the respiratory channel. It enters in. Once it does this, then it goes and it does its thing. So one of our approaches is to limit and mitigate the viral replication, and as well as to see the concomitant bacterial infections that actually occur. So when we look at bacterial infections, where does the body end up getting them? Much of these infections end up causing injury to the lungs. The lungs end up causing so much immune reaction that it actually lowers the body's ability to fight itself, and basic infections come from our own bacteria. So at that point, these concomitant infections really go crazy. And at that point, that's where the damage occurs, when the body's immune reaction goes haywire, and then causing the congestion and limiting the body's ability to transfer oxygen. The ultimate effect limits the amount of oxygen to the brain, to the kidneys, and we have eventually liver, kidney, or heart failure as a result of this. So in terms of that, what we got to do is figure out, how do we protect our skin? How do we protect our eyes? Obviously masks in, but this is not what helps this is not where I'm at. I'm not at that clinical level that I'm approaching this. We're actually providing this information so we can look at information that we can prepare our bodies physiologically. You'll see here that there are some treatment protocols that we have there. We're going to go there in a few moments, but I wanted you to at least see that there, okay? So again, oral hygiene, making sure we take care of our teeth. Intestinal hygiene is very important. Probiotics are very important, and to maintain those aspects of the body are critical in terms of being able to assess that. Also, we talk about vegetables, and we're going to get to that second. So let's go back to the first section there, okay? So as we go to the first section, we talk about the antiviral approaches, and we talk about the botanicals. These are things that we can do, that we can get. Now, by the way, everything we have on here, we're going to have links to it and places that you can find it. You can find this on the internet, and these things are readily available so that people can find that information. Now, let's go to the nutraceuticals that we are going to be discussing that we can assist there. We're going to see that the licorice root, and I know that Estate has discussed this, and I'm going to have her kind of bring in a little bit of the information that she has researched here, specifically about this particular list, and tell us what she has noted in this particular dynamics. Estate, go ahead and tell them a little bit about what you found out in terms of this particular panel and this presentation right here.
Okay, well, discussing the antiviral nutraceuticals in this, I guess in the first approach by Dr. Alex Vasquez, researchers have found that I guess prescribing 240 milligrams of licorice root 3 times, I guess between meals for a week, can actually inhibit the growth of several unrelated DNA, RNA viruses, and it inactivates herpes simplex virus particles. So basically, licorice root, according to these research studies, has been demonstrated that it can help fight certain infections. And another research study has found that injection therapy of licorice root can be useful for the progression of disease in what is known as interferon-resistant patients with HCV-related cirrhosis. And other research studies related to licorice root have also found that it has a certain type of activity against HIV-1, SARS-related coronavirus, respiratory syncytial virus, and other viruses as well. And but I guess notably, licorice root is also found to be most active in inhibiting replication of the SARS-associated virus.
The papaya leaf juice, what is is there a specific dose that Dr. Alex Vasquez indicates?
We actually found that he didn't quite mention that there was a specific dose, but I just wanted to point out that when Dr. Alex Vasquez, when he mentions papaya leaf juice, he's specifically talking about the juice from the leaf, not the fruit. But it does have a direct antiviral action, and it basically functions through the inhibition of viral assembly as well as replication.
So I notice is the Melissa, the lemon balm. What's the no specific dose on that either, correct?
Yes, again,
Okay.
no specific dose on that
And by the
one.
way, everybody, we're going to have all this being able to, if you're going to be able to find that on the links that we have. So you'll be able to reference that and you'll be able to assess that later in the presentation. So lysine and zinc. Tell me a little bit about what the presentation presented on that, because I got much to say on that. Go ahead.
Yeah, so Dr. Alex Vasquez and these researchers in their research studies, they showed that providing zinc with, in a dosage of up to 50 milligrams per day, I guess it has a direct antiviral effect, and the zinc ions to have this direct antiviral effect. And lysine, specifically 1,248 milligrams per day, taken between meals in combination with licorice root, lipoic acid, and other Nf Kappa-B inhibitors have been demonstrated in these research studies to help improve lifestyle, like overall health and wellness, essentially.
I noticed that selenium is also there. Selenium, the approach to selenium, these are all, as we notice, as it says on top, this is the antiviral approach. The antiviral approach is to limit the ability of the virus from replicating when it first insets. Now, back away and digress a little bit in this process for the antiviral approach. So go ahead and leave away. And let's go ahead and to talk to someone who it really matters to, this information, because this may seem like I'm going out in left field, but I also have here a mom who is actually has a lot of concerns. And those questions that we presently have are pretty much in the minds, if not in the forefront of someone's minds, but or in the back end of someone's mind as to what kind of questions. And I'd like for you to hear the type of thought process that a mom has to protect and to help and to prepare a family. So Trudy, tell me a little bit about when you've been exposed to this knowledge and you see this on CNN and all the medias, how does it affect you and what are you looking for in terms of answers?
Well, basically, as a mom, one of the big things that we always do since, we get babies is practice good hygiene. So it's very important, as a mom to always make sure that your kids are always washing their hands, not just when this type of chaos is happening. We definitely need to continue to always wash our hands. But it's information overwhelming, to be quite honest with you, because you hear different facts and things that are true and are not true. There's so much information out there. So to me, it would be important that what is a proper protocol other than good hygiene, good rest, good nutrition to be able to implement and in the different type of age groups. Like, for example, I have teenagers. What are the exactly dosages and where would I get this and how do my kids take it? So that way, if we ever get exposed to this type of coronavirus, we know the proper protocol. Also, what areas, I'm glad that you guys are putting out there all these links that we can research and get the correct information. So going back to the different supplements that you were mentioning, we're going to be able to come up with an exact dosage and protocol. Is that something that people will call to the clinic and get this type of information? Or what would be the process?
That's a great question because what we're going to do is here, we just started with the antiviral therapeutics, but we're going to digress a little bit to the health coach because the questions are going to be, well, where do I get my stuff, right? That's where Kenna is going to be able to give us some information. Kenna, tell us a little bit about what we can do to help people and guide people other than just this basic information.
Right. So as you guys were talking about hygiene, of course, making sure you're brushing your teeth at least twice a day, flossing. So much bacteria is in your gums and it actually goes into your bloodstream through there. After that, we want to make sure you're, like I said, showering, bathing, washing your hands all the time, things like that before you eat, after you touch a doorknob, you pump gas, all of that stuff matters. As far as the specific nutraceuticals go, I do have some protocols that we've researched in place. They're about to be shown on the screen. So if we all take a look, I actually have 3 separate things here. The first one I want to call attention to is a hand sanitizer recipe. I know that hand sanitizer is selling out extremely quick in most places, but this is a recipe that you can make your own sanitizer at home. It's 4 ounces, so it's not a lot, but it's better than nothing, and you can keep it with you, travel in your purse, things like that. And then we also have to the right of that, my recommendation for adults. So the adults have all of these supplements that we will go into a little bit more detail as we're going through the different stages. But you can see right there, licorice extract is on there, as well as greens first. What this is it's a powder, and you can actually get 20 plus servings of fruits and vegetables just within 2 scoops. So when we add that into water every single day, it's really going to help our guts. It's going to help just fight off more things. Your immunity is going to be stronger just by those increased vegetables, because sometimes getting all the servings that you need is not as easy as we think.
Now, I was going to ask, is this a link that we can get, or is that something that we can, because I know that we tried to create a link that was available to our patients, because these are many times pharmaceutical grade, as well as grades that are limited by the state and to regulations. We have to have it go through a doctor. So this is something that you can present, or you print up, or just take a picture, or chew on this a little bit and get presented to your doctors and let them see if they recommend this for you as well. Okay, so this is depending on each individual based on that. So tell us a little bit about what else we have on here. Okay.
What else we have on here is for the kids, because they are smaller and they're a little bit more sensitive. We have a recommendation of probiotics and multivitamins. Multivitamins are great because they do provide so much of the actual vitamins that you need and all the little things that your body could be lacking. So those are really going to help your children. Also, with the coronavirus, like, kids are showing more to be carriers and not less be infected. So they can test positive for this, but they're not getting sick. However, that doesn't mean that they can't bring it home to their parents and their family, which is why it's important that everybody gets that protection that they need to really help build their immune system.
I'd say that they are infected, but they're not actually presenting the symptomatologies or presenting the results of that. So they are carriers because certain people become carriers and certain people become affected by it. So there's a whole lot of predisposition factors that to this day aren't figured out. But what we're trying to do is to lay down some nutritional physiology that is actually going to give you the strength and the ability to do the best physiologically in return. In terms of that, what else we have, Kenna, there?
I also put my email and my phone number up on the screen. If you would like the direct link to these supplements, if you email us with your first name, your last name, and then, of course, your email, or you call us and give us that same information, this is how we'll be able to send you the direct link for the supplements that we have made up for this protocol.
Again, the other thing that we also notice is that on many times you may want to always, and this is something I highly recommend, you present this to your doctors and let them kind of become a team with you in this process, because misinformation is what we're certainly not wanting to do. We want to add information and give you more options. I was going to ask Trudy if she's had any frustrations listening to what people are purchasing on the internet, or the mass kind of hysteria we have going throughout our country. Have you noticed that, Trudy, at all?
Oh, absolutely. I mean, obviously, there's a back order on hand sanitizer, on any type of disinfectant wipes, toilet paper. I don't know why, but people are just going crazy buying toilet paper, and then it's just kind of like, like the sheep protocol. Everybody's doing it. I'm thinking to my head, do I need to buy it too? I mean, are we going to run out? Unperishable goods, canned soups, and it's just, all this kind of chaos that it's being created. Unfortunately, a lot of the times, because of the wrong information. And I'm glad that we're putting the right protocol as far as nutraceuticals. Absolutely ask your doctor first, but at least it's given us the regular population that we don't have all the background on medical approach, what to do as from a proactive approach.
I think it's irresponsible from anyone who knows something and doesn't share it. So today's forum is this, and we are as such. Let's go back to section 1, please, on the antiviral issues as we are preventing the antiviral replication. So that was basically part 1, okay? And we can go into the nutraceuticals, and let's go back in there, and we can take a look at that's the beginning, okay? So where we're dealing with zinc, lysine, and selenium specifically, these are to prevent antiviral replication. So that's the important component there. Let's go to section 2 now, and that's where we're going to bring in Alexander, who's going to help us a little bit understand in terms of the replication issues. Now, again, as we go in here, we can actually see that there's some DNA components. You're going to hear a lot of talk about N-acetylcysteine and selenium and zinc, and he's got a little bit of an approach and presentation regarding the DNA and its effect on the how the virus affects the DNA. So tell us a little bit of Alexander as to what your thoughts are on this.
So there's a couple of different approaches that I'd like to take a look at here. First one, I'd like to highlight what Ms. Trudy was talking about, how all the hand sanitizers are kind of going out of sale. So hand sanitizers have a alcohol base to them. They're pretty good at killing bacteria, but not as effective as washing your hands. The main reason is that these soaps that you use contain a chemical called SDS, which is an amphipathic molecule, which is kind of the technical term for saying that it has polar and nonpolar regions. So the cool part about these amphipathic molecules is that it denatures these proteins and forces them to pretty much congregate in different directions, exposing them in directions that they wouldn't normally be exposed. So that's why washing your hands is more effective than using hand sanitizer. Versus hand sanitizer, yes, you may kill off most of these viruses, but any of the viruses that have lived are already going to develop an are going to be immune pretty much to these hand sanitizers in the future. So always make sure that you're washing your hands. Now, when it comes to stuff like zinc, so zinc, I know that Dr. Vasquez had explained to it, pretty much says that it has antiviral properties. So let's kind of explain what that means. So zinc at the molecular level is a positive ion, so it's Zn2+. When we look at the DNA and RNA structures, all these structures are negatively charged. So when you have a negative and a positive structure, they tend to attract to each other, and once they congregate and they bind to each other, they most of the time cannot replicate or function in the way they were designed to. So whether it's zinc or magnesium or any positive ions, they're going to end up binding to each other. And keep in mind that Dr. Alex Vasquez only prescribes 50 milligrams of it?
Correct.
I believe.
Up to.
Up to 50 milligrams. So make sure that you're not going overboard with zinc, because I can tell you personally, zinc poisoning is not a fun thing. So make sure everything in moderation is always condoned. So that's how these positive ions interact with each other. Now, when it comes to N-acetylcysteine and selenium, there's a couple cool things about them. So cysteine and selenium are mainly involved in the glutathione pathway and formation. Now, glutathione is the body's most powerful antioxidant, and it's composed of glycine, glutamate, and cysteine. NAC is used in a couple other treatments. For example, it's also used in acetaminophen overdoses in hospitals. But another important aspect is used to rejuvenate those glutathione levels. Now, glutathione is going to have a very specific mechanism on how it works. Its main job is to break down hydrogen peroxide that the body normally forms. Now, when you have a cell that's been hijacked by a virus, it's going to end up producing a lot more oxidative stress on the cell, eventually causing apoptosis. In normal conditions, when a cell goes through apoptosis, it's...
I'm sorry, Alex, what is apoptosis? What is apoptosis?
Apoptosis is a fancy word for saying cell death. So pretty much the cell just explodes.
Gotcha.
At the cellular level. In normal situation, we would want this for a cell that's not functioning correctly or that has exceeded its lifespan. But when we're talking about virulent infections, the virus is replicating in large amounts within that cell, causing this stress on the cell. And when it dies or explodes, hence apoptosis, it's going to start infecting other cells at an exponential rate. So by rejuvenating these glutathione levels through the use of N-acetylcysteine or NAC and selenium, which is the cofactor for forming glutathione, we allow the cell to keep up with the mechanisms that the virus is producing and allow the body kind of like a buffer period so it can actually kill off these viruses in its normal immune response.
So what you're basically saying is N-acetylcysteine could be considered the it helps strengthen your immune reaction by powering it up and making sure that it continues in the right direction, correct?
Exactly.
Oh, got it. Okay, makes sense. Okay, so did you want to add something else right there? No?
And then just selenium is the cofactor to produce and form glutathione.
Got it. Okay, let's go back out. Let's go take a look at the presentation here. So as we look at that, let's go ahead. So the issues is that when the virus comes in, it typically it hijacks the NRF2 factors or the NRF2 factors. Let's go ahead and look at inhibitors of Nf Kappa-B. And the area here, this is to stop the replication. So these are things that we have been able to use we have many research articles. And again, I have a link on the front page that you can actually see all the documentation and the research behind each one of these supplements. As to what to take and how to take, please understand that these are the information that is presented out there. We must have your doctor evaluate these first. If you've got kidney disease, if you've got heart disease, it is wise to always talk to your doctor, because what a person with kidney disorder may have or may not have ability to, that's where those smart people like a nephrologist would actually say this is a good thing or this is not a good thing in your particular situation. Now, Steve, you put together here a little bit of the supplementations. Is that correct? And these particular supplementations, I know it was either myself that instructed you or Kenna. Which one was the one that put together this list here?
It was between everyone.
Got it. So let's go through those and tell me a little bit about them. If you could read those out so people can actually have this as the auditory sound as well sees these.
So basically, some of the nutraceuticals that we have here, these are, as you mentioned before, these are inhibitors of Nf Kappa-B. Essentially, Nf Kappa-B is it's a main component that is associated with their immune system, and then within the cell, this is what controls inflammation and what controls all of these inflammatory responses that are from the immune system to control infections and viruses and things like that. So the list that we have here, it's quite a long list, actually.
Let me go ahead and read them. So we have, obviously, vitamin D3. D3 is huge. It shows so many positive results. We've got the CAPE, which is the B propolis, Boswellia serratia, coenzyme Q. We got curcumin. We got GLA. We got the grapeseed extract. We got green tea. We've got, go ahead and pronounce these. It says isohumanones and lipoic acid. Mm-hmm. We got EPA. We got resveratrol. We've got rosemary. We got selenium. We got zinc. We got alpha lipoic acid and glutathione. Okay, these are all things to inhibitors of Nf Kappa-B, which is causing the inflammatory cascade. So if we can take supplements that have this in it that are natural, that's the best way to approach and at least one option to approach and to supplement our immune structure. So we're going to go back away from this for a second here, and we're going to go into the area of the number 3, which is the cell support system, which is part of immunonutrition. Now, in the terms of the immunonutrition, again, we got the arrow pointing to the other part of the Venn diagram here, okay? Now, nutrition and the immune function emphasizes low carbohydrate. This is very critical. We cannot be taking simple sugars when our bodies is having this kind of dealings and preparing our body for, let's say, an issue. We also got the things that are on here like smoking. Smoking has also been known to the people who have a history of smoking seem to have a little bit of harder work through with the virus. So what we want to do is we want to limit those things that cause oxidation. So tell me a little bit about this, because Kenna, you were the one that presented this one a little bit, right? So as we did that, I want to go ahead and at least understand a little bit of the approach of the vitamin A, vitamin D3, zinc, and probiotics. Again, as you notice, a Venn diagram offers a ability to see how things correlate, and though this may be just the part of the immunonutrition, it also correlates with anti-replication genomics as well as antiviral effects. Go ahead.
All right. So if you go ahead and click into the nutraceutical bubble, it'll expand on those vitamins just a little bit more. Once again, these are studies that are in Dr. Alex Vasquez's book, and from what his research has shown, vitamin A is great for all ages. So these are just a few different doses that are up on the screen, but it has been shown that 300,000 IU per day for 3 to 5 days of vitamin A can help with acute infections. So we're really going to want those vitamin A numbers or vitamin A to be present in the vitamins that we are taking. That way we can be sure to kind of combat this in case we were to come in contact. You want to be prepared first. So you don't always have to start taking these vitamins after you're starting to feel symptoms or things like that. Talk to your doctor now, bring him to him tomorrow, things like that, so you can kind of start to get your immune system prepared in case you are to come across this.
And by the way, all these supplements are part of small little packages and vitamins, and people have done all this hard work for you, but this is kind of the background knowledge for that. Go ahead.
Also, infants and ages 6 to 11 months, you can also take 1 100,000 IUs per day for 2 doses, and that has also been shown to help with measles. So as you can see there, it's helping with infections and measles, things like that. Those are all obviously things that happen to your immune system. So vitamin A is a super great one. Another one that we mentioned is the vitamin D. Vitamin D, 4,000 to 10,000 IUs per day for acute infections has been shown to help fight it off and reduce the rate at which it's producing inside of you.
Yes, as the virus load,
Yes,
the
there you go.
replication of, yeah, I got you.
All right. And then also at the top, we have glutamine, and that one has been shown 9 to 18 grams per day between meals. So that one will also help with, the research that has been shown is sickle cell or burns. So it's going to help heal, and it's going to help your body where it needs help.
In terms of this presentation, we're going to do this in dicing. This is a one long one, but we're going to dice it up and we're going to break it apart. But we wanted to do it's quite large and quite long and quite lengthy, but we will break it up into part 1, 2, 3, and 4 to discuss this particular dynamics in terms of preparing your family. Now, let's back away a little bit for a second here. Now, I'm going to go back to Trudy, because what I want to do is I want you to give me what are you looking for in terms of as a person trying to protect your family, specifically regarding supplementation?
Well, other than obviously, always doing good hygiene, what would be the first step for me as a mom to take, not just for my family, but for my children? What would be the immediate thing that I should be doing?
First thing is to begin slowly. We don't want to be taking boluses. This is no different than trying to, be fed once every 30 days and take a blast. The body that progressively begins the process of nutrition does it over time, because the body gets stronger over time. So in essence, we first have to realize that our diet today, or the SAD diet, which is the standard American diet, has a lot of holes in it. And what we want to do is to begin the process of upping the ante in for our immune system, cleaning out the issues, make sure our children have probiotics, make sure our children have great oral hygiene, so that the immune system can respond better. So in essence, preparing your family by understanding intestinal oral health is a huge component of what goes on, but also going into and preparing the cellular physiology for the, let's say, inevitable body immune, insult or preparation process, because not everyone gets this and not everyone presents symptoms. But for those that are prepared better, well, it's just very common sense that they will bode better. So I hope that answers your question in terms of things you can do. You got to get water. You got to make sure your children are hydrated. You've got to make sure your kids sleep well. So sleeping is a critical thing, because there are so many physiological processes that get recovered. And even though it seems like an easy way out to give an answer, go to sleep better. No, sleeping is huge. The body who sleeps and the body that rests better is the body that protects itself better, if that makes any sense. What other questions did that help you with that answer?
Oh, absolutely. Definitely, it gives me a big picture of, what would be the steps. And I think you touched on a very good point that you said, this is, little by little. You're not going to start taking all this tons of supplements all at once and expect results. Number one, good diet, rest, good hygiene, and start implementing the supplements, and then the key point here is check with your doctor, and also outreach to us, and we can certainly give you, some direction as what are the steps to take. But yes, absolutely, it answers
to make it logical and an easier approach. You know what? It's like you're going to get it on, okay? If you're going to get it on with the virus, or if you're going to get it on with your immune system, what are you going to do? You're going to prepare. It's like a meat. You're going to prepare your body to prepare. You just don't show up without training for it or getting the body ready for it. So as the body gets ready, it needs nutraceuticals. It needs phytonutrients. It needs good vegetables. It needs good stuff in the body. So that's what our job is to do, to rev up the ante, to get the body ready for any possibilities, so to speak, in terms of in our new world here. So.
And then I guess a good one to add to, I guess if someone just wanted to start off with something simple, especially for their kids, one good one to do would be cod liver oil. Cod liver oil is really high in EPAs and DHA, so we got that omegas covered there. It's also high in vitamin D, so we got that covered there, and it also has vitamin A as well. So if you wanted to start off with something simple, I definitely recommend cod liver oil. I know that there's different flavored ones online that don't taste like too fishy, and that's a great way just to start off with something simple, as well as good nutritional support while you're eating. Make sure you're eating a bunch of different vegetables as well as rest, like you said.
Yeah, so that's huge. I mean, Grandma was right. Grandma was right, giving you a thing of cod liver oil. Grandmas were very aware that exercise in moderate amounts. So keeping your body active and avoiding, and also avoiding the lack of inactivity, because inactivity breeds the body's inability to react. So the more, if you get some basic exercises, don't go extreme, but work out, but get it going on. Also, the logic is that to avoid people, and as they can't, you can't say it enough. If someone's sick, send them home. There's no reason to test the body and to put the dynamics of, let's say, your work environment in that arena. It is easy, and I think the government is making sure that everyone gets taken care of, at least on the economic level. So when we look at that, let's go back to the immunonutrition. We're talking about the vitamin A, vitamin D, and zinc, and probiotics. Again, the Venn diagram, as it describes, does cover these things. Now, glutamine and arginine and nucleotides are things where we are looking at, those are amino acids, and that's why we want to make sure that the protein levels are good in the body. Because as the studies do show, that the people who have glutamine, arginine, and nucleotides, or good protein, have a less of a morbidity or mortality rate, and specifically of what the results are with this particular dynamics. Now, in terms of the stage level 4, which is the cell support, because we've gone in that area, what we're going to do is we're going to kind of bring an end to this in a moment, but I want people to kind of see what they can do in terms of diet. There are paleo diets, which improves insulin, sensitivity, and reduces cardiovascular disease. These are good diets to follow. The standard American diet, which is the SAD diet, it causes systemic inflammation, oxidative stress, which is what we've been talking about. We've been talking about antioxidants and limiting the ability of the Nf Kappa-B system or from kicking off, or the hijacking of the NRF2 factors, which is the area where viruses vector towards and they try to replicate themselves. So if you can prepare the body better, this is always a better approach. Now, again, you have your fruits and your vegetables to reduce upper respiratory infection. Well, the ability to have selenium, zinc, glutathione, and acetylcysteine, these are areas that we can prevent the replication of the virus. Vitamin D3 is huge in its ability to help out and protect us at the endothelial level. It is obvious. It is one of our greatest areas that produces the vitamin D, which is our skin. It is our biggest protector, and when exposed to the sun, it actually provides the D3. In this situation, what we want to do is we want to supplement with that. And I think we went through that. Now, let's go back to the main areas, because I want to leave you guys with at least a visual of that one right there, of what we have in terms of our approaches. Now, there are different approaches here from the youth to the adults as well as the teens. But right here we have a whole list we've just gone over, but there is no replacement from good food, okay? Pharmacology will not replace food, okay? It just doesn't change, and it doesn't bode well to try to create pharmacology answers, but they work together. There are definite antivirals that work together, but we cannot replace good nutrition. And the most important thing here is to give ourselves and individuals like our families, and Trudy, who was indicating like what to do and how to feed our families. So Trudy, a little bit about if you kind of got some information here that would help you in terms of how you can protect or better prepare your family, other than just buy toilet paper.
Right? So don't go buy toilet paper right now.
Well, yeah, you need toilet paper, but we got to be
but
confident.
don't go crazy. Well, basically, I mean, what I'm getting, get a good multivitamin, obviously enough sleep, continue to do good hygiene, not just now, but continue throughout the rest of your life. Not sugars, because obviously, bacteria and viruses, they thrill on sugars. And that's something that I have learned in the past with my kids that is just not good. Sugars are not good. And giving them a good balanced meal. Absolutely, get away from the fast food, get good snacks, so that way they can always have something to go to, that it's not sugary, that it's nutritional, that it's well balanced, and implement the veggies.
I'm going to go ahead and I'm going to flick this over to Kenna, because what I want Kenna to give me is a little bit of insight as to what goes on. But before I go to Kenna, I know that Astrid wants to say something. She wants to point out some particular aspect of this particular screen. Go ahead.
Well, I basically just wanted to give everyone kind of a takeaway, because we've been discussing a lot about these supplements, and I'm pretty sure a lot of you guys, all these viewers and everyone who's listening in, Maybe this is a bit of an overwhelming list. There's
Maybe.
probably a bunch of supplements here that maybe a lot of you have never heard about. So I want to, as the chief editor for Dr. Alex Jimenez's blog, I've done tons of research on a bunch of these supplements, but I want to give you guys a bit of a takeaway. So I want to kind of discuss one of my specialties, one of the things that I love to research about mostly is about nutrition and these nutraceuticals. But I actually want to discuss kind of like we've mentioned, these supplements. You want to first make sure you talk to your healthcare professional, to a doctor, and discuss, what's the proper dosage, basically for you to take and to increase your immune system. But one of the things that I actually want to do to basically highlight, for all of you guys, so you are listening in, all the viewers, it's important to also follow a good nutrition, kind of like rest, keep a hygiene and be involved in exercise and physical activity. But we also want to make sure that we're putting in good food in our bodies. We want to, in order to promote overall health and wellness, we want to be able to eat good food. So kind of like how we were talking about going into the immunonutrition part of this presentation, of this podcast, protein is actually very critical for our immune system. And one of the supplements, one of the nutraceuticals that are up here on this list that I really want to highlight is actually glutamine. So in clinical practice, glutamine is recommended to take within 9 to 18 grams per day between meals, or that is 3 to 9 grams basically 3 times a day for breakfast, lunch, and dinner. But actually, to provide you guys with that bit of a takeaway, I want to discuss what you can eat actually to, I guess, to kind of bypass a little bit of these supplements. If we're not sure where to get these supplements, if we still need to take that extra step to go to the doctor and to talk to, to get the proper dosage, there's actually there's actually several foods out there that you can eat. Give yourself proper nutrition to provide yourself with glutamine. So just to kind of, give you guys a little bit about what glutamine is, since we're kind of highlighting it, we keep referencing a lot to it here. Glutamine is actually an amino acid. What that is that it is actually a building block for protein. So as we discussed, protein is absolutely critical for our immune system. And glutamine, it is actually naturally produced in the body, and it is actually one of the most abundant amino acids that we have. But now, given kind of going into this whole coronavirus and infections, people who are already hit with these infections, people who have injuries, even I found in certain research studies that people who have severe burns may also have certain glutamine deficiencies because their immune system is basically going haywire, is going crazy. So we can find glutamine in the highest amounts in animal products.
What products did you have? Do you have any specific ones?
I have eggs, beef, milk, dairy products, basically like those kind of animal products essentially. And glutamine can also be found in some amounts in plant-based foods, and those are the ones that I want to kind of highlight are white rice and corn.
The N-acetylcysteine is a precursor to the glutamate areas. So one of the things is that when we have the driver NAC, N-acetylcysteine, it actually is the thing that works along with that particular amino acid. Mm-hmm. So let me ask you, in terms of this approach, Kenna, going back to Trudy's design, what can these, what kind of directions can we give individuals in terms that have questions or want to further kind of help their families lay down some more protection?
Right. So going off of all those points, we can, of course, I put my email up on the screen earlier and our phone number, so you can always take the recommendations that we have to your doctor, as well as email us or call us with certain questions you have. But in addition to that, things you can take home to your family would be, of course, the hygiene. Just start a good multivitamin. That one's going to have everything that you need. NAC is a great supplement. Vegetables, as we were talking about, and a great thing for kids for snacks, something quick. You can cut up bell peppers, avocado slices, carrots, tomatoes. All those things are quick to grab if you already have them cut up in your fridge. A great snack, and they'll keep your kids away from chips and things like that. That'll kind of decrease their immune system. They're still getting that crunch that they're wanting.
All right. Well, thank you guys. And I want to tell you that, again, everything in here has been put together because the knowledge is out there. We just have a tendency through our awarenesses to sometimes not open the book of the past. And these ideas of this virus, so this is a very virulent virus. It has its power. You can see it propagating through the United States. You just have to go to the CDC website as it travels. You can see it traveling through Europe, and as it enters a mechanism, it begins. It has a beginning, it has a middle, and it has an end as it works its way through. Because we're here in the States and it's starting really at this point, we want to make sure that we also help people prepare. Because when people don't know how to prepare, they make some judgment calls that are kind of just a little chaotic, like we keep on using the example of buying too much toilet paper, because it seems like they're just, everyone's, because they don't know. So excessive buying occurs. But when we think about it, what do we do and how do we do it and when do we do it? And that's my purpose of presenting this thing. So as we do this kind of stuff, it's not to jump in and present a level of information that is disinformation. We're just presenting information that's already out there. And this information has been put together by great scientists, great doctors. We referenced one, Dr. Alex Vasquez here, who really has taken a life work of making sure that we have antiviral strategies. And that, I do think, when it comes home to it, people want to know, and people do want to prepare their families. And for the people who get educated, they start getting pieces and pieces and pieces, and it becomes frustrating. Here it's kind of put together, but before anything, you got to take this information and present it to your doctor and say, is this okay for me? And let that approach kind of be the thing that guides you. But like anything else, if we're going to head into a meet, we're going to prep. We're going to get ready. We're going to get it on. And as we get it on, the best way we can get our children and them to be able to get it on with the world that they have to deal with is to prepare. So that is our entire purpose of this Antiviral Strategies. We're going to continue to do this kind of stuff and present so that it is out there, and let it fall where it may. And it may be offensive to some. It may be useful to others. And I hope and pray that everyone can use a little bit of information and look around and say, hey, you know what? Eating McDonald's is not... eating food that not just McDonald's, but foods that are not as well nourished in those areas, or fast foods, those things are going to be probably not the best option. But because you can eat McDonald's if you probably eat good food too, but you got to prepare the body in a better way. So my goal here is not to present too much information, but for those and the world that right now wants to learn, it's available, and here we have it. So I thank you guys for the opportunity, and we will continue to bring in information. And again, this information was brought to you because people want to know. Okay, thank you guys.